Hello, my name is Molly, and today I will be demonstrating the use of the Universal Curette by scaling the full mouth. So the main purpose of this instrument is to remove both supragingival and subgingival calculus from all surfaces on the tooth. And so the instrument I'll be using in the video today is the 5-6 Universal Curette. And this instrument has a rounded toe and two cutting edges so that it can be used on all surfaces throughout the mouth. And it has a curve to it so that it can reach posterior teeth. And it can also be used for anterior teeth. The other curette that's also in our kit is the 4R4L. It has a little bit of a thicker design, so it's a little bit harder to reach approximately. So also has the same purpose, but for the purpose of this video, I will be using the 5-6 curette. So same thing as I've been doing in our other instrumentation videos. I'll be using a modified pen grasp and using my ring finger to fulcrum.
Alright, so here I am starting on the buccal surfaces on the upper right quadrant. So I'm starting on the distal of number 1. I want to insert my instrument at a 0-degree angle and then get my 70 to 80 degree adaptation of the cutting edge in order to remove the calculus. So for these teeth, I'm using an extraoral fulcrum on the mandible. So like I said, I start on the distal and then I'll reinsert the distal buccal line angle to work my way along the straight buccal and then turn my way into the mesial to get interproximal calculus removed. So I've changed my fulcrum to an intraoral fulcrum once I reach that first molar. So here I really want to rock on my fulcrum, and I'm kind of lifting the handle of the instrument up as I'm moving up along the teeth in order to stay parallel with the long axis of the tooth, but also have that 70 to 80 degree angulation. And also importantly, the working end I'm using, the V of the instrument is pointed towards the distal. So we can see here that even on the premolars, the V of the instrument is pointed towards the distal. So now as we're moving to the lingual of the upper right quadrant, I've changed sides on my instrument so that the V of the instrument is still pointed towards the distal. So with the curette, we can go a bit more subgingival to remove subgingival calculus. So as I mentioned, I will try my best to insert at a 0-degree angle. I'm still working on that. But then once I insert, then I'll get to my 70 to 80 degree angulation to remove the calculus. So once again, for these maxillary molars on the posterior, starting with the extraoral fulcrum and rolling interproximally so that I can remove calculus in those hard to reach areas. So for these teeth, I'm using my mirror with indirect vision so that I could see the surfaces I'm working on. So I want to use short controlled oblique strokes and activating with lateral pressure when I feel any sort of calculus that needs to be removed. So similar to the buccal, once I reach first molar, I've changed to an intraoral fulcrum, and especially on the premolars, that way I can rock on the fulcrum and have good control of my instrument. So also while I'm practicing, I'm also listening, and I could hear my adaptation when it has a nice scraping sound that indicates to me that I have proper adaptation. So now I've moved to the buckle of the upper left quadrant. So the correct working end, once again, the view of the instrument is pointed towards the distal of the tooth. And, I'm kind of blocking the view a little bit there, but I do use my mirror here for indirect vision, since these are surfaces away from me. So also, if this was a real patient, the mirror would help to retract the cheek. So same principle here. Want to get my 70 to 80 degree angulation so that I can use lateral pressure to remove any sort of calculus. And here I'm using an intraoral fulcrum, so I want to rock on my fulcrum and use short controlled strokes to remove both subgingival and supragingival calculus in these areas. So once I reach the line angle, I want to roll the instrument so that I don't lacerate the papilla. I want to keep everything adapted, keep that tip 1/3 adapted. Also, I should have mentioned that earlier, but that is really important to keep just the tip third adapted so that we can safely remove the calculus. So now I'm just moving to the lingual surfaces on the upper right. So starting on tooth number 16, I'm also starting with an extraoral fulcrum, and when I'm adapting, like I said, I want to keep my tip 1/3 of the instrument on the tooth, and in order to do that, I have to roll once I get in there proximally, and then when I feel calculus, I will activate my stroke with lateral pressure using my thumb, and I'm at a 70 to 80 degree working angulation to have those short biting strokes. So here on the maxillary, I've also changed to an intraoral fulcrum, kind of once I reach that first molar area. It's kind of the tooth that I like to change depending on the anatomy of the patient's mouth or their teeth. Might depend a little bit, but for this type of dot in specific, that's kind of what's been working for me. So here, once I've reached those premolars, same principles. And now I'm working on the facial surfaces of the interior teeth. So I'm doing the surfaces toward me on the facial. So the correct working end of the instrument, the V is pointed towards the midline of the tooth. And as I start on the midline of the tooth, I'll insert at 0 degrees and then establish my 70 to 80 degree angulation. And I'm using an intraoral fulcrum and rocking on my fulcrum. And like I said, starting at the midline and then working my way along the surface toward me, rolling interproximally once I reach that line angle to remove calculus that could be in those interproximal areas. So now I'm changing to the buccal surfaces on the maxillary anterior teeth, the facial surfaces on the maxillary anterior teeth, surfaces away from me. So I've changed the side of the instrument that I'm using so that the V of the instrument is pointed towards the midline of the tooth. So, same principle as the buccal surfaces. I want to make sure I start at the midline and slightly overlap, just because I don't want to miss any calculus, just because the midline is the area that could be easily missed. So I want to make sure very thorough in removing calculus from the entirety of the tooth. So here as I'm working, now I'm changing it to the lingual surfaces. So I'm doing the surfaces toward me and using my mirror for indirect vision, in order to see the lingual surfaces toward me on the maxillary of the anterior teeth. So same as the facial surfaces, the view of the instrument is pointed towards the midline of the tooth. And I want to establish my 70 to 80 degree angulation and roll interproximally so that I can remove all of the calculus that could be both subgingival or supragingival calculus. Okay, and as I've mentioned before, I want to use short controlled biting strokes, so that I have good control over the instrument. I don't want to be slipping on the tooth, so I also want to have a solid fulcrum, as I'm working on every single area. So now I'm switching to the lingual surfaces on the maxillary anterior teeth, surfaces away from me. So for these teeth, I'm sitting at a 12 o'clock position using my mirror to see with indirect vision. So starting at the midline and then establishing my 70 to 80 degree angulation of the curette so that I can remove calculus and activate with lateral pressure. Alright, so now we're moving to the mandibular teeth, and I'm starting on tooth number 32 on the buccal surfaces on the lower right. So my correct working end, the V of the instrument, is pointed towards the distal of the tooth, and starting on the distal side of the tooth, then I'll insert at a 0 degree angle, then I'll establish my 70 to 80 degrees, and then I will roll into the contact. Then I will remove the instrument, reinsert at the distal buccal line angle at 0 degrees, and then reestablish 70 to 80 degrees, work my way across the straight buccal, then roll my instrument once I get to the mesiobuccal line angle, and then I will activate with lateral pressure in order to remove calculus and keep those short controlled biting strokes is always the goal. So also watching this video, there's a couple areas I think I can improve my control, so that is definitely something I will continue to work on. And as I do these premolars want to activate my strokes when necessary. So now I'm just doing the lingual surfaces on the lower right. So I've changed the direction, or I've changed my working end of the instrument of the curette. So I'm also using my mirror for indirect vision. Also, if this is a patient, it would help to retract the tongue in this quadrant. So with these posterior molars kind of having a little bit of an extended grasp, just so I can reach back there and still fulcrum like 1 to 2 teeth in front of the tooth I'm working on and reach the molars. So still having my modified pen grasp though, always fulcruming on my ring finger, rocking on my ring finger to activate my stroke. I like to think of it as I'm opening a doorknob, that kind of motion, in order to achieve the correct adaptation and motion without using finger flexing is also a big concept that I've been working on. So I'll work my way along the mesial side of that tooth, and I want to hear a nice scraping noise to indicate to me that I have good adaptation of that tip 1/3 of the instrument at that 70 to 80 degrees is what I'm looking for. Sorry, it's a little bit hard to see with the reflection of the light on my mirror. There I could see a little bit better as I'm doing the distal of that premolar. So rolling there at the line angle. Now reinserting to do the mesial. And kind of adjust my fulcrum there a little bit, just because I feel like I didn't have quite a good steady fulcrum, so I want to make sure I have a good fulcrum before continuing. Alright, so now on the buccal surfaces of the lower right, I have my correct working end. The V of the instrument is pointed towards the distal of the tooth, and also using my mirror for indirect vision and to retract the cheek. So also apologize that it is pretty bright there. So now I'm moving on to tooth number 18, and want to rock on my fulcrum and angulate the instrument tip 1/3, 70 to 80 degrees. And also there, just adjusting so that I can get a steady fulcrum and a good angle there of the instrument so that I can safely insert the instrument at 0 degrees and then establish my 70 to 80 degrees. So as I move more interiorly, also sometimes I'll move a little bit more at like a 10 o'clock so that I can have good ergonomics and keep my wrist in a proper position. So now I'm moving to the lingual surfaces on the lower right, and same thing as the other posterior teeth I've been doing, have a slightly extended modified pen grasp so that I can reach all the way to the terminal molar there, tooth number 17. But since I don't have a tooth number 19 on this hypodont, kind of fulcruming there on the buccal facial surfaces of the surrounding teeth. But either way, still want to have a steady fulcrum so that I can effectively remove the calculus. So as I'm doing these premolars, same thing as the other quadrants, the B of the instrument is pointing towards the distal of the tooth, and that's a good visual cue that I know I'm using the correct working end. Also, I can make sure that the shank goes up and over the tooth as well to verify I have the correct working end. Alright, so now I'm moving towards I'm doing the anterior teeth. So I'm doing the facial surfaces on the mandibular teeth, anterior teeth, surfaces toward me. So the correct working end of the instrument, the V is pointed towards the midline of the tooth. And same thing as the maxillary anterior teeth. I'm going to start at the midline of the tooth and then establish my 70 to 80 degree breaking end. I want to keep that tip 1/3 adapted so that I can remove calculus. And the instrument, the curette that I'm using, is a little bit of a thicker curette. So if I had a patient that had really, really tight gingiva there, I would have to be really careful or possibly choose a different instrument in order to safely work around the gingiva without injuring the tissues. So now I'm doing the surfaces away from me on the maxillary facials. Mandibular facials, surfaces away from me. So I've changed my working end so the V is pointed towards the midline of the tooth. And for these, I've moved to a 12 o'clock position so that I can rock on my fulcrum and keep that tip 1/3 adapted to the tooth. So fulcruming like 1 to 2 teeth away from the tooth that I'm working on. And I want to use short, controlled, biting strokes, as I've mentioned before. So now I'm moving to the lingual side of the mandibular anterior teeth, and I'm going to do surfaces toward me. So I'm using the mirror for these lingual surfaces, and I want to be very thorough here, especially because this is where the most calculus buildup is. So I want to make sure to keep my tip 1/3 adapted, angulate, get that proper angulation at 70 to 80 degrees so that I can remove both supra and subgingival calculus. Alright, and then last clip here, I'm doing the surfaces away from me on the linguals of the mandibular teeth on the anterior sextant. So same thing as I'm doing all video. Want to insert at 0 degrees of the midline, establish my 70 to 80 degrees, keeping that tip 1/3 adapted, rocking on my fulcrum to activate my stroke with lateral pressure and remove the calculus. So I'm also using my mirror here for indirect vision so that I can see exactly what I'm doing as I remove calculus and use the Curette, the Universal Curette.
Okay, so that was my video demonstrating the use of the 5/6 Universal Curette to scale the full mouth. I'm still working on my 0-degree angulation and my control of my short biting strokes, especially on areas with indirect vision. So that is something I will continue to work on and improve on. And next week I will be getting into the use of Gracie's with the 1-2 Gracie. So thank you very much for watching the video. Apologies it was so long. And that will be the conclusion of the video.